On est prêt? Bonjour tout le monde. Mon doux. Va falloir qu'on recommence. Bonjour tout le monde. Bonjour. Ah, et oui, on a une bonne nouvelle aujourd'hui. Alors, il faut avoir un peu d'entrain. Good morning, bon matin tout le monde. Quoi? Ça me fait un plaisir. Mon nom est Mona Fortier. Je suis la députée d'Ottawa-Vanier. Et je suis très fière d'être ici avec vous aujourd'hui. Je voulais quand même commencer par dire c'est la journée de la francophonie. Alors, bonne journée de la francophonie à tous. And as it's Francophonie Day, we will still do this in both official languages, but I think it's important to recognize that it's an important day for our community. I also want to acknowledge that we're gathering today on the traditional territory of the Algonquin Anishinaabe peoples. And thank our guardians of our land for all that they do from the past, the present, and the future, making sure that our lands are guarded. Ça me fait un grand honneur de revenir ici à Montfort aujourd'hui pour une annonce qui, je pense, ça fait longtemps qu'on a hâte d'entendre. Je voudrais évidemment reconnaître certaines personnes qui sont avec nous aujourd'hui. Alors, je vais commencer avec mon ami et collègue Bill Blair, le ministre de la Défense nationale, ma collègue Marie-France Lalonde, secrétaire parlementaire au ministre de la Défense nationale et députée d'Orléans. Merci d'être là aujourd'hui. Thank you so much. Dominique Giroux, directeur général de l'hôpital Montfort. Carl Napper, qui est également ici. Bonjour, merci, Monsieur le Président du Conseil. Also, I'd like to recognize Major General Malcolm, Honorary Colonel Monsieur Sekula, Commander Turcotte, and Chief Warrant Officer Mayo. And all of you here, distinguished guests, so glad to see you all in this important room that we have here à l'hôpital Montfort. Et comme je dis, ça fait un grand plaisir parce que vous savez, j'ai une longue histoire avec l'hôpital Montfort. Non seulement j'y suis née, ma fille y est née, j'ai eu le privilège de servir au conseil d'administration de l'année 2007 jusqu'en 2016. Alors pour moi, j'ai une longue relation avec l'hôpital Montfort et c'est toujours un plaisir de revenir ici parce qu'il y a tellement de l'excellent travail qui se fait dans la communauté et pour la communauté. It's a real privilege for me to be here today. I have a long history with Montfort Hospital. I was born here. My youngest daughter was born here. I had the privilege to fight for this hospital many, many years ago. And also, I had the pleasure of serving on the board of directors for many, many years. And I'm glad to see many members of the board here and my former president, Alain Michel Sekula, who we served together on that board. Now, let me take a moment as we kick things off to say thank you. Merci. Thank you to all of the health workers and staff that work here at the Montfort Hospital, but also at the Canadian Forces Health Services Center. To our healthcare workers, dentists, janitors, support staff, pharmacists, nurses, doctors, and everyone who keeps this hospital running every day, 24/7, know that we are very grateful for everything that you do. I know that things are not always easy and that there are many day-to-day challenges that each of you face. Vous savez, la pandémie et tout ce qui est venu après était éprouvant pour nos travailleurs de la santé à travers le pays et je sais que c'était aussi le cas ici, à Montfort et au Centre des services de santé des Forces canadiennes. Malgré les difficultés auxquelles vous avez fait face, vous continuez d'être présents pour ceux et celles qui en ont terriblement besoin. And as a mom of 3 young adults now, there are a few worse things than having a sick loved one and needing to take care of them and bring them to the hospital. In those moments, you realize how much good health care really matters, and you truly appreciate how lucky we are to have excellent and dedicated people like you helping us when we so desperately need it. L'hôpital Montfort est une place importante non seulement pour les hommes et les femmes de nos forces canadiennes, mais aussi pour de nombreuses familles ici à Ottawa, dans la région de la capitale nationale et dans l'Est ontarien. Vous aidez plus de 1,2 million de personnes et ce, fièrement, dans nos 2 langues officielles. Et je sais que vous effectuez un travail extraordinaire en formant la prochaine et les prochaines cohortes de travailleurs de la santé francophone. Montfort Hospital is an important place not only for the men and women of our Canadian Armed Forces, but also for many families that live here in Ottawa, the National Capital Region, and Eastern Ontario. You serve over 1.2 million people, and proudly, might I add, in both official languages. And I know you're doing exemplary work to train the next cohorts of Francophones healthcare professionals. And for 71 years and counting, you have been there to support your community through thick and thin, and I know you will be there for many, many more years to come. Now, before I ask my honorable colleague to come and speak, je voudrais quand même aujourd'hui qu'on se rappelle d'un souvenir. Et j'en parlais justement avec les gens qui nous ont accueillis plus tôt ce matin. J'aimerais reconnaître un homme qui a fait toute la différence pour la première entente qui avait eu lieu avec l'hôpital Montfort et les forces canadiennes, et c'est l'honorable Maurice Bélanger, qui était mon prédécesseur. Maurice Bélanger was a game changer for Montfort Hospital and the arrangement with the Canadian forces. And I really want to recognize his hard work. We know that he has now a star taking care of us, but if it wasn't for this man who had thought about the idea of bringing Canadian forces together, partnership with Montfort, we wouldn't be here today. And it was really important for me, Minister, and everyone here to really recognize his hard work. Alors, Monsieur le Ministre, vous savez, il y a une longue histoire. There's a long history here in this partnership. And I'm very proud to say that now you will be announcing a great announcement that will pursue this great relationship. Thank you for being here, my dear friend. And now I will welcome you to the stage to share a few words.
Good morning, everyone. Bonjour à tous. It's a great honor to be here this morning at Montfort Hospital for today's announcement, and I am particularly honored and pleased to be joined by, and we'll move the microphones because
see, I'm short.
And I can never be short, but I'll try to be brief. I'm particularly pleased to be here at Montfort, joined by my 2 colleagues, Marie-France Lalonde and Mona Fortier, 2 of the hardest working and most effective colleagues that I have in government, and people who have shared with me their passion for this hospital, their passion for the people that it serves, and they both shared with me the long history and the connection that this hospital has. It's also very appropriate, and I'm very glad that you mentioned our dear friend and colleague, Maurice Bélanger, for his vision, for his commitment, for his hard work. He was an inspiration to us all, and we all honor his memory. And I think today, as we make an announcement about the continuation of what Maurice began, it is appropriate to honor and recognize his hard work, but also the hard work of so many who work side by side to make this all possible. For years, the staff here at Montfort Hospital have worked alongside members of the Canadian Forces Health Services to provide extraordinarily high care, quality care to members of our military stationed here in the National Capital Region, from everything from minor checkups to major surgery. This hospital and all of the men and women who work here have been there for the men and women who serve in the Canadian Armed Forces and in uniform. Let me say that as minister, there is nothing more important to us than our people. People are the strength, they're the heart, they're the reason that Canadians have such an extraordinary armed forces who have taken on the important task of defending this country. I know how much we ask of them. We ask a great deal of them. Many of them suffer unique health challenges as a result of what we ask of them. But for them and their families, there is no more important commitment that we make to them to make sure that they can serve in a healthy way, in a supported way. And I know that both I and the staff here at Montfort agree on this. It's very important that in return we give them the best health care services as a way of acknowledging and thanking them for their extraordinary commitment. Now, originally, as has been mentioned, our original contract with Montfort which was established in 2003, was set to expire in 2026. But I have some very good news to share with you. And today I'm going to make an announcement, but I also want to acknowledge that ministers get to come on the final day and make an announcement, but it is a reflection of a lot of hard work. And I want to acknowledge the members of the board, the members of the staff, the members of the Canadian Armed Forces who've worked so hard to bring us to this announcement today, to make sure that we can continue and build upon the extraordinary work and the relationship that has existed here now for over 2 decades, but has a future and is going to continue. And today, I have the privilege to announce that we've extended this contract for another 6 years, which means that we will continue working together, and I say to it at least into 2032, but this is only an extension. And the importance of this relationship also requires that we be prepared to continue to build upon it, to extend it, and to continue to provide the important services here at Montfort for many years to come. As I've said, we've had a strong working relationship with Montfort Hospital for over 2 decades, and our partnership is essential to providing healthcare services to CAF members. We are investing $100 million to extend this contract so that the dedicated D&D and CAF healthcare team can continue to provide that essential care. This partnership is also going to ensure that the Canadian Armed Forces Service Centre Ottawa and the number 1 dental detachment can continue to operate in Montfort Hospital's Wing D, where they're already doing some extraordinary and excellent work. And with this new contract in place, we're also expanding the care offered to our people here with a particular focus on mental health supports. These partnerships are essential to our military and unique to the circumstances of our members. As part of their duties, CAF members may be posted outside the province in which they currently reside. And when that happens, they need to have the peace of mind that no matter where they go in this country, that their health will be our priority and that they will be taken care of. The Montfort Hospital and other institutions right across Canada provide a place where dedicated CAF medical professionals can treat their patients while providing access to a larger network of civilian healthcare practitioners working right alongside them. And together, you all help to guarantee that there are no gaps in care, especially as CAF members move from one province to the next. Our Armed Forces members work incredibly hard for us. They serve our country, they protect our country. Whether they're out battling wildfires, conducting search and rescue, they have always been there to answer the call. When Canadians needed members of the Canadian Armed Forces, they were always there to say yes. The very least that we can do, it is a sacred obligation, is to provide them with the quality health care that they need and that they deserve. And that's exactly what Montfort Hospital provides. I want to take this opportunity to thank you all for your dedication to providing this care to CAF members over the last decade and a half, and I know that you will continue to show the same commitment, skill, and expertise as we keep working together for the health and well-being of our men and women in uniform. Thank you. Merci. I'd now like to pass the microphone over to my colleague, then Parliamentary Secretary, the Honourable Marie-France Lalonde, to deliver her remarks. And it's particularly appropriate and a very good thing that here today, as we celebrate La Journée Internationale de la Francophonie, that I am joined by my very dear and cherished colleague, Marie-France, please.
Je suis pas aussi grande. Merci beaucoup, Monsieur le ministre. Bonjour à tous. Comment ça va? Quelle belle annonce. Écoutez, en cette journée internationale de la francophonie, c'est un plaisir d'être de retour ici à l'hôpital Montfort, un des meilleurs employeurs de la région de la capitale nationale et aussi le seul hôpital universitaire français de l'Ontario. Quel honneur d'être présente. Écoutez, comme vient de souligner le ministre Blair, le personnel de l'hôpital Montfort travaille avec les membres des services de santé des Forces armées canadiennes depuis 2009 pour fournir des soins de haute qualité à notre personnel militaire affecté à la région de la capitale nationale. Que ce soit pour effectuer de simples bilans de santé ou d'importantes chirurgies, vous avez été présent pour les membres de nos Forces armées canadiennes et on vous en remercie. En tant que secrétaire parlementaire au ministre de la Défense nationale, notre priorité, ce sont les membres de nos Forces armées canadiennes et leurs familles. Nous demandons beaucoup à nos membres et à leurs familles.
Et je tiens personnellement à vous remercier tous et chacun pour vos services à notre pays. C'est toujours un honneur pour moi de me retrouver en votre présence. Je sais aussi que le personnel ici à l'hôpital Montfort est d'accord avec nous. C'est vraiment important que nous soyons là pour nos membres et que nous leur donnons les meilleurs soins de santé possibles. Et c'est grâce à vous tous, ici, le personnel extraordinaire de l'hôpital Montfort. Notre contrat avec Montfort devait à l'origine prendre fin en 2026. Et nous avons annoncé, et j'ai l'honneur de vous l'annoncer en français aujourd'hui, que nous avons prolongé ce contrat pour une période de 6 ans. Nous poursuivrons ainsi notre collaboration au moins jusqu'en 2032. Nous entretenons une solide relation de travail avec l'hôpital Montfort depuis maintenant plus de 2 décennies. Je sais que ma collègue faisait référence qu'elle était née ici. J'ai l'honneur et le privilège de pouvoir aussi attester de ceci. J'y suis née moi-même. Notre partenariat est essentiel pour fournir des services de santé aux membres des Forces armées canadiennes. Notre gouvernement est fier d'investir plus de 100 millions de dollars pour prolonger le contrat afin que l'équipe de soins de santé à l'hôpital Montfort puisse continuer à fournir des soins. Ce partenariat permettra également au Centre des services de santé des Forces armées canadiennes d'Ottawa et du 1er détachement dentaire de poursuivre leurs activités dans l'hôpital Montfort, où ils font déjà de l'excellent travail. Et de plus, et je pense que c'est très important de souligner cette composante, de plus, avec l'établissement de ce nouveau contrat, on va élargir la gamme de soins offerts à notre personnel ici à Montfort, en particulier dans le domaine de l'aide en santé mentale. De tels contrats sont essentiels pour nos forces armées et adaptés sur mesure à la situation particulière de nos militaires. Et c'est encore important de souligner que nos militaires ont des besoins précis et des fois différents de d'autres individus au niveau civil. Et dans le cadre de leurs fonctions, les membres des Forces armées canadiennes peuvent être déployés en dehors de la province où ils résident actuellement. Et dans ce cas, ils doivent avoir la certitude, n'importe où qu'ils aillent dans ce pays, que les soins de santé seront toujours là pour eux. L'hôpital Montfort, de même que d'autres établissements au Canada ayant conclu des contrats similaires, fournit des locaux où des membres du personnel médical dévoué, des FAC, des Forces armées canadiennes, peuvent traiter leurs patients tout en leur donnant accès au vaste réseau de professionnels de la santé civile œuvrant à leur côté. Cela contribue à garantir qu'il n'y a pas de lacunes dans les soins, en particulier lorsque les membres des Forces armées se déplacent d'une province à l'autre. Les membres de nos Forces armées canadiennes travaillent extrêmement fort pour servir notre pays et protéger les Canadiens. Que ce soit dans la lutte contre les incendies de forêt ou les opérations de recherche et de sauvetage, ils répondent toujours à l'appel, et on a vu cet appel dans les dernières années, ici dans la capitale nationale. Le moins qu'on puisse faire, c'est de leur fournir les soins de santé dont ils ont besoin. Et c'est précisément ce que l'hôpital Montfort offre. Donc, je tiens à vous remercier, nous tenons à vous remercier des soins dévoués que vous fournissez aux membres des Forces armées canadiennes depuis la dernière décennie et demie. Je sais que vous continuerez de faire montrer du même dévouement et de déployer toutes vos compétences et votre expertise dans le cadre de notre collaboration continue pour assurer la santé et le bien-être de nos militaires. Je vous remercie beaucoup et je passe maintenant à la parole au président, et je peux dire le nouveau, il n'est peut-être plus aussi nouveau qu'on doit dire. Ils disent qu'après une semaine, bon, tu sais tout. Mais j'aimerais passer la parole à notre ami et au président et directeur général de l'hôpital Montfort, Dominique Giroux, qui est revenu au bercail, que j'ai pu comprendre. Donc, Dominique, à toi la parole. Merci beaucoup.
Bonjour, Annie. Good morning, everyone. On behalf of our 2,800 employees, physicians, volunteers, and the more than 1,600 learners who we train annually as an academic health science center, welcome to Montfort. Mon nom est Dominique Giroux et j'ai le privilège d'œuvrer comme président-directeur général de l'hôpital Montfort et de Santé Montfort. and also serve as board chair of the Ontario Hospital Association and as special advisor to the French language health services to the CEO of Ontario Health. Il me fait plaisir de vous adresser quelques mots ce matin au nom de Carl Napper, président du conseil d'administration de l'hôpital Montfort, et de François Brouard, président du conseil d'administration de Santé Montfort, qui gère la relation avec la Défense nationale. I want to thank Minister Blair, l'honorable Mona Fortier, députée d'Ottawa-Vanier, la secrétaire parlementaire Marie-France Lalonde. Perhaps we'll need some T-shirts about Montfort kids or Montfort babies. Major General Malcolm, Commanding Officer Turcotte, Lieutenant Colonel Jeté, and all members of Canadian Forces Health Services Ottawa and One Dental Unit who are here this morning. We're very excited to renew the long-term collaboration between the Canadian Forces Health Services Centre Ottawa, the One Dental Unit, and Montfort, organizations that continue to excel and to evolve to meet the ever-changing needs of the patients we serve. Montfort was founded 70 years ago as community leaders identified the need for a Francophone hospital. At the time, the Filles de la Sagesse, the Daughters of Wisdom, mortgaged all their Canadian assets to fund the construction of this hospital to meet community needs. And since then, we've been recognized for a 9th consecutive year among Canada's top 40 research hospitals. In December, we were recognized among the top 3 Canadian hospitals with the highest growth in research income. In February, Newsweek identified Montfort among Canada's top 50 hospitals, up 20 ranks in the last 5 years alone, and we were recognized for the 5th time among the top employers in the National Capital Region. And according to the Canadian Institute of Health Information, CIHI, Montfort is one of only 4 Ontario hospitals to not generally perform below average on any of the 12 quality and safety indicators that it tracks for all hospitals in the country. We're proud to be one of the few Canadian hospitals to have been accredited with exemplary standing, the highest accreditation rating for 3 accreditation processes in a row, and to maintain above average patient experience survey results. Not only do we operate an academic hospital, we also founded a research institute, a long-term care home, an academic family health team, the new Aline Chrétien Health Hub in Orléans, a mental health center in Rockland, and co-founded Montfort Renaissance, an organization with 10 facilities here in Ottawa, supporting the needs of geriatric, mental health, addictions, and homeless patients. And much like Montfort, the Department of National Defense innovated in 2003 by deciding to establish a military clinic within an existing civilian healthcare facility here in the National Capital Region. Et en juin 2009, les opérations ont débuté à l'LD de Montfort, juste derrière nous, et c'est un honneur pour nous de soutenir les services de santé des Forces canadiennes et l'unité dentaire 1 dans la prestation des soins de santé et de bien-être aux militaires. Et nous apprécions l'opportunité de partager notre expertise de part et d'autre, notamment pour soutenir les services de santé tels que les services de chirurgie, d'urgence, de laboratoire et d'imagerie diagnostique. This partnership is good for the clinicians and patients of the Canadian Forces Health Services and the One Dental Unit, and it's good for the clinicians and patients at Montfort. We learn a lot from one another, and together we create value for Canadians. Notre entente renouvelée permet également d'étendre la présence à Montfort, comme on l'a souligné, pour la prestation de services de soins de santé mentale aux membres des Forces armées canadiennes. Et à cet égard, Montfort fait partie des 15 plus grands hôpitaux de l'Ontario en termes de capacité en santé mentale. Minister Blair, thank you for entrusting Montfort with the ability to work alongside colleagues from the Canadian Forces Health Services Centre Ottawa and the One Dental Unit. And on a personal note, I want to convey how much we enjoy the relationship with Commanding Officer Turcotte and value her inspiring leadership. Aux députés Mona Fortier et Marie-France Lalonde, merci d'être des championnes aussi convaincues de la mission de Montfort et de notre partenariat fructueux et de longue date avec le Centre des services de santé des Forces canadiennes Ottawa. And to all colleagues from the Department of National Defense and the Canadian Forces Health Services Centre and the One Dental Unit, thank you for your service and for being such great, long-standing partners. We value our relationship, with you and look forward to continuing to build on the success of the last 20 years. Merci beaucoup. Thank you, miigwech.
Wasn't that good news? Two key words, people, partnership. I think that is what we've presented today. Alors, je pense qu'aujourd'hui, en conclusion, on peut dire, premièrement, que c'est une excellente annonce. Et deuxièmement, qu'il y a deux mots-clés que j'ai entendus dans tous les propos, les gens et le partenariat. Alors, en cette grande journée de la francophonie, mais aussi grande journée pour le partenariat entre Montfort et les forces canadiennes, je vous remercie beaucoup d'être ici. Et là, c'est la partie favorite pour certains d'entre nous où on répond aux questions venant des médias. So I will let you manage this Q&A period. This is the favorite part, of course, of the day. And we'll ask Minister and Marie-France and Dominique to be ready to answer questions. Merci.
So we'll get started with the questions and answers now from media. We'll be doing one question, one follow-up. Please just state your name and your outline before asking your question. Nous commençons maintenant la période des questions des médias. Si vous pouvez dire votre nom et le nom de votre organisation avant de poser votre question, vraiment c'est une question ensuite.
Good morning, Minister.
Good morning.
Antoine Trépanier from Lalonde. My question is regarding mental health today. One of your former officer at the Toronto Police, Bradley Gagnon, who you gave the merit mark back in the days, came out last week with his struggle about PTSD. And he said how the psychedelic assisted therapy, mostly MDMA therapy, helped him to live, actually, and to continue his life today. I'm just wondering, how do you feel about these kind of treatments for actual military members, for police officers, and veterans as well?
Thank you very much for the question. And as we talked today, mental health services are critically important, particularly to those who serve our country and our communities in uniform. We know that there are injuries that can sometimes be invisible but can be very impactful, and the important work that's done here at Montfort Hospital and the expanded work that is also being developed to make sure that those services are available are critically important. However, with respect to any particular clinical treatment, I think determining the safety and efficacy of those treatments is best left to professionals. And I know that Health Canada has that responsibility to determine whether or not a particular pharmaceutical treatment for these conditions is both safe and effective, and I'll leave that determination to those professionals.
A Senate committee last fall said in a report that Health Canada should have a more urgent way of doing things. Do you agree with their conclusion in the report last fall? And what should be done right now?
Thanks. I've previously served as parliamentary secretary to the Minister of Health. I'm well aware and have great respect for the excellent work that's done at Health Canada to make sure that pharmaceutical and clinical treatments that are approved for use in Canada are both safe and effective for Canadians. We rely on that expertise. I also appreciate that there is, I think, for those who suffer, a sense of urgency. We share that sense of urgency, but we also recognize the importance of making sure that it is both safe and effective.
Thank you, Minister.
Thank you.
Any other questions for media?
I can go on.
We know that. Yes, of course.
Actually, we've taken up a lot of everyone's time. I wanted to take the opportunity to thank you all for being here today. We're very pleased and honored for this partnership, this relationship, and the fact that it's going to continue. I also wanted to take the opportunity, because I should never miss the opportunity, to thank all of the members of the Canadian Armed Forces that are here, our Surgeon General, Director Tukot, for all the outstanding work that is done here. We're very proud of the men and women who serve in our Canadian Armed Forces. I hope that Canadians share in that pride, and I hope we all share in our collective responsibility to make sure that we provide those supports and services. Thank you very much. Merci.
Now, the conclusion of a great event is pictures. And I think we could maybe take the time to have those of you who have worked so hard on this agreement to come forward, and we can share a good picture, and then we can share with the community what we've done today. Merci.
I'm just wondering, is that movable?